Psilocybin, otherwise known as magic mushrooms, have been largely considered by policymakers as nothing more than a recreational drug. But new research and advocates have pointed out that psilocybin can be used as an effective treatment for all sorts of disorders, such as PTSD and even brain injuries. One of those advocates is two-time Stanley Cup champion Dan Carcillo, who, after retiring from the NHL due to traumatic brain injuries, has found relief and recovery by using psychedelics. Joining us now is Dan Carcillo to share his journey from NHL heavyweight to psychedelic advocate. Dan, thank you very much for joining us on Forum Daily.
Thanks for having me.
So before we talk about your use of psilocybin, can you walk us through the state you were in when you retired from the NHL, how you got to the point where you considered psilocybin as a potential treatment?
Absolutely. So I had a close friend who passed away. His name was Steve Monador, a former teammate. He had 19 confirmed concussions in the league. I had just recently had my seventh right before we won our second Stanley Cup in 2015 with the Blackhawks. And I was dealing with mild dementia symptoms or CTE like symptoms, headache, head pressure, insomnia, impulse control issues, light sensitivity, slurred speech, on top of anxiety, depression, and suicidal ideation. And it was very apparent to me that I wasn't going to be able to do my job, and there just wasn't much in the way of active treatments that league doctors would prescribe us or put us through.
And so how did you come to these substances in particular as a potential treatment?
Well, I retired in 2015 at the age of 30, and that really just started my medical journey. I'm pretty well read, so I started to read PubMed papers and get dialed into concussion rehabilitation centers, CT brain bank, stroke rehabilitation centers,
Mhm.
and just listening to a lot of medical professionals telling me that they could use diagnostics to identify an area of my brain that was shut down due to trauma and then wake it back up. And I thought that all sounded great until I was about $500,000 in the hole that I had spent, and nothing was getting any better. So I actually read a study that was done in 2014. It was then 2017 when I saw it, and it was a study with the Imperial College of London and a brain on psilocybin and a placebo brain. And I saw the connections in the right and left brain hemispheres that were being made. And
Mhm.
I just had an aha moment that this could possibly work for me. So I took an invitation in 2019 to a farm in Denver when it was decriminalized. So I knew that I couldn't get arrested for using these substances because they
Mhm.
are Schedule One. And that's really just when my life changed. I just remember waking up, and I describe it as feeling the way I should after one 5 hour ceremony.
And what is a ceremony like that like? What is that experience? I think for a lot of people, they maybe stereotypically think of bad trips and all sorts of other examples like that. What is it like to go through that 5 hour experience?
So there are parts where it's difficult, and that's why there's a lot of preparation that's done. And there's everything is done and administered in a very controlled setting.
Hmm.
And the dosage is well managed. And you're usually with somebody that has been through the experience several times. And when the set and setting, so your set intention for why you are doing this medicine and the actual environment is really well curated, then you can have these profound results that John Hopkins is reporting with depression patients, where they no longer qualify for a depression diagnosis for up to a year.
Hmm.
And, that's the kind of beginning and the middle part of the preparation and ceremony. And really, the most crucial part is to integrate the lessons learned in these ceremonies into your everyday life. So, for example, I was suicidal. I was caught in a very negative and victimhood mindset in this sort of loop. And this medicine during the ceremony basically brought me into this loop that I was recreating and walking around the farm for about 2 hours. And it was as simple as this thought of you can just stop walking in a loop, you can just stop this behavior tomorrow. And it seemed to have just broken up this destructive thought pattern. But then I had to take the onus and really implement it into my life. And when I saw certain things coming back into my thought patterns or my relationships
Hmm.
or my work, I would really have to consciously make sure that I was present enough to make sure that I would stop those types of patterns.
We're going to go to break, but when we come back, I want to talk a little bit more about those results and that experience. We'll be right back. And we're back on Forum Daily. I'm joined by Dan Carcillo. Dan, before the break, you had mentioned your journey with psilocybin, that 5 hour experience. Have you been able to get brain scans or any other kind of medical diagnostics after your treatment that show the progress that you've made?
Absolutely. Yeah, before leaving for the retreat, because I was in so many of these stroke rehabilitation or concussion rehabilitation clinics going through diagnostics like QEEG, which is a brain scan that measures the electrical waves of the
Hmm.
six hemispheres and how they're communicating. I took that scan before I left because I knew how highly stigmatized these medicines are. And if it worked for me, I just wanted to be able to back it up with some science. I also took blood work, and after two of these big dose ceremonies, 3 months apart, and some low dose therapy, I was able to get clear brain scans at the 6 month mark, as well as no abnormalities in my blood work.
You've made obviously quite a career shift now. Can you explain to us what you're doing for other athletes who are maybe experiencing what you were going through when you stepped away from hockey? Because obviously, this isn't hockey specific. There are a variety of professional athletes in numerous sports who leave the game with all sorts of traumatic brain injuries and the issues associated with that. What is next for you? Are you helping others in the athletics world kind of try and make this transition and find recovery?
Yeah, absolutely. So, really, the number one thing that I do is try to, show and live a life that's worth living, showing people that I am completely cured from something that I was told was intractable or incurable, which is mild dementia symptoms or CTE like symptoms.
Hmm.
And if I can continue to do that, then I'll continue to have hundreds of former athletes, executives, people that have either been through the same thing that I've been through in collision sports, or if you've been through the military,
Hmm.
or if you're an executive that maybe fell or got into a car accident. It really doesn't matter what arena. But a lot of these people reach out and they want to get connected to some of this therapy, and that's really what I'm doing now is in real time taking people on retreats and opening up a psilocybin clinic in Oregon where it's legal. It has a regulated
Hmm.
statewide adult
Yep.
therapeutic use framework.
I'd like to shift gears here to the stigma surrounding these substances. What was the response of those who are close to you, family, friends, when you told them that this was going to be part of your recovery?
Their reaction was similar to others, where it was, "What is this again?" And so
Yeah.
really, I started to tailor the way that I spoke about presenting this to my family. And I was kind of lucky where I didn't stand on a mountaintop and start shouting this. I tried to live it. And then when my family started to see how much better I was, because it was very apparent how bad I was, they started to ask questions and they actually started to go on this medicine themselves. And so, before I really, when people ask questions, one of the things that I say is if you'd like us to try a medicine that is full spectrum, that has little to no side effects, that has no abuse liability that we know of, that can make you calmer, connect you back to the present moment, make you a more creative person, have better access to your brain, help you with sleep and recovery, would you want something like that? And obviously, most times the answer is yes.
Of course.
And then when you tell them that they're mushrooms, they take a step back. So I don't usually lead with that.
Yeah.
And then I just connect people to the studies done by John Hopkins, Imperial College of London, NYU Langone, the fact that the FDA has designated this their breakthrough therapy designation with 3 different companies.
Yep.
And all of those things combined usually help people to shift their mindset away from the ingrained stigma that we all have.
We have about 40 seconds here. What should policymakers know, or what should the public know about the medicinal value here?
Yeah, I think that everybody should know that this is an option, that hope is right around the corner. There are a number of different companies that are very close to developing this as a medicine. And there are actually 23 adult therapeutic use states that are in some active legislation right now. And if you're
Mhm.
suffering, then look up Oregon and Measure 109, Prop 122 in Colorado. Those 2 states have approved an adult therapeutic use framework that people can go and access now.